Hello, I'm Dr. Grocott from Wilmslow Health Centre. Following on from my last video on prostates, I thought I would talk a little bit about the PSA test, as it's something that people often come and ask me about. The PSA test is a blood test that's measuring something called prostate-specific antigen, which is a chemical released by the prostate. Raised levels can mean that that man has prostate cancer. So it's a test for prostate cancer. Well, unfortunately, it's not quite that straightforward. And in order to answer that, I think we first need to talk a little bit about statistics. Unfortunately, no diagnostic test is perfect. You can get false positives or you can get false negatives with any test. In the context of the PSA test, a false positive result would be a raised PSA result in a man who's not got prostate cancer, i.e., the PSA should be normal, but the test is wrong and it's come out as being raised. A false negative result is the opposite of that. The patient does have prostate cancer, but the test has come back as being normal. I think the risks of that are pretty simple. You know, the test has missed the cancer, the patient's been falsely reassured. But a false positive result can actually be just as damaging in certain cases. It can cause a huge amount of anxiety. It can lead to further tests and investigations, sometimes with permanent complications and side effects from that, all for something that wasn't necessary in the first place. So, a PSA result by itself is actually of quite limited clinical value, and for that reason I would argue that the PSA test is actually not a test for prostate cancer. But it is, however, a very useful tool which, alongside a patient's symptoms and alongside a prostate examination, can help us to decide whether that man is at risk of prostate cancer needing further investigations, or if they can be reassured and sent home. I hope that makes some sense.